Preparing.
Hey, hello there, Facebook. Welcome. BJ Lang here, board member for the Testicular Cancer Awareness Foundation and fellow survivor. We are here with another installment for Testicular Cancer Awareness Month of Ask the Doctor as we prepare for the upcoming virtual Testicular Cancer Conference. If you have a question, go ahead and pop it in the chat. And please, even if we're not live and you're watching this later on, if you still have a question, put it in the chat because we still monitor those questions. If you're joining us right now, or if you watch this later on, you could also like and share and tag your TC friends in there. We'd love to connect with them. All right. So I told you who I am. It is, as I said, Testicular Cancer Awareness Month. So we have a special guest today. But before I get to that, I want to make sure that you guys are all up and up with everything that we're doing here at TCAF. We'll have a few more of these live events with Ask the Doctor. I have another one tomorrow. I hope you'll join us for that. And again, next week, of course, the 20th and 21st for the Testicular Cancer Awareness Foundation's virtual Testicular Cancer Conference. Want to make sure that you've been checking out our podcast. That's our official TCAF podcast hosted by Stephen Crocker, fellow survivor and board member here with TCAF. It takes balls. And today's guest, who you're going to be seeing here in just a minute, is going to be on there as well. And his episode drops on the 29th. So hope you'll listen to that. Mark your calendars, as I said, the 20th and the 21st. That's going to be from 8 to 9 p.m. Eastern and 5 and 6 Pacific time for the virtual Testicular Cancer Conference. That's 2 evenings. And you, your family, your friends, if you're a researcher, if you know someone that works in urology, if you know a patient, if you know a survivor, if you know a caregiver, invite them to come and hang out with us. We'll be welcoming testicular cancer medical experts covering some very important topics here for the upcoming conference. Things like, why did I get testis cancer, COVID and the vaccine and how it relates to testis cancer, long-term side effects and prevention for TC. We'll have breakout rooms with some of the doctors who you've been seeing me do the Facebook Lives with. And we'll connect, of course, with Stephen Crocker, It Takes Balls, host of the TCAF podcast. You can hear our guest right now clearing his throat because he's got so much medical knowledge that he wants to share with us. I know you're getting ready, Doc. We'll have updates from our friends at the Uniball movie. How awesome is that? Q&A with the medical experts. We'll have other researchers there. So we'll have doctors from Penn Presbyterian Hospital, Penn Medicine, Indiana University School of Medicine that work closely with Dr. Einhorn, the University of Colorado Health and Children's Hospital, Colorado, as well as UC San Diego. You'll be able to meet fellow survivors and caregivers from across the United States, as well as other countries. So it's a great opportunity to make some great social connections in the TC community. If you've been unable to attend any of our in-person conferences, this is the opportunity for you now to come virtually and hang out with us and be a part of the TCAF community. And you'll get to see everything that TCAF does, our ambassadorship, connect with our Facebook group, and folks from all around the TC industry in the world. Industry? That's probably not the right word, but you know what I was going with that. All right. As I mentioned, we'll have some great experts that are going to be there supporting the TC community. Today's guest will be at the upcoming Testicular Cancer Awareness Foundation upcoming virtual Testicular Cancer Conference, which again takes place the 20th and the 21st right here on the internet, and you can join us. He'll be available during the Ask the Doctor segments, and those times are going to be very small, very intimate. It'll be a great opportunity for folks to get questions out and have time with those doctors. So I hope that you'll join us. Right now, if you do have any questions, go ahead and pop those in the chat. And our folks here at TCAF, we're going to pop those over into the Zoom, and I'll be able to ask your question right here live on Facebook. And get ready here in the chat. All right. Today's guest completed his urology residency at Indiana University and then went on to complete a 2-year urologic oncology fellowship at the University of California, San Francisco. In addition to his fellowship, he completed a master's of public health degree from UC Berkeley with a concentration in epidemiology. His clinical interest is in urologic oncology with a focus on surgical management and advanced testicular cancer and bladder cancer. His research efforts focus on health services and outcomes research in testis and bladder cancer. We're delighted to have him here on the Ask the Doctor segment for TC Awareness Month. Please welcome Dr. Clint Cary. Hey, Dr. Cary, welcome back to TCAF.
Hey, thanks for having me, BJ. Yeah, you caught me. I'm so excited to get going here. I'm clearing my throat. I'm ready to rock and roll.
It's all good. It's all good. So first of all, you're in Indiana, so we have to ask, how often do you see Dr. Einhorn?
I see him on a daily basis. He has clinic hours Monday, Tuesday, Wednesday most weeks. So I see him pretty much all of those days, and occasionally I'll run into him on Thursday and Friday. So it's pretty much a daily thing.
Copy that. Copy that. As folks are getting their questions ready, Dr. Cary, I like to just kind of open the book a little bit and kind of get to know you a little bit. Can you walk us through where you're from, how you got into urology, and why on earth urology?
Yeah, it's a good question. So I grew up in a little small town in Tennessee, and kind of one thing led to another. Found my way to medical school, and actually a funny story about urology. I didn't really know what I wanted to do when I first went to medical school. I think I thought I was going to be orthopedic surgery just because I grew up playing a lot of sports and was very active growing up in that regard. And it just didn't grab me like I thought it would. And one of the other classmates said early on in my first year of medical school, she wanted to be a urologist. And at the time, I wasn't even sure what a urologist did. Probably like most of folks in the country and around the world, you don't really know what a urologist is until you have something like this diagnosis happen to you. And one thing led to another. I knew I enjoyed surgery, and I started exploring the different surgical subspecialties, and this just kind of appealed to me for many reasons. And I was fortunate enough to match and train here at Indiana University, which kind of set me on this path, and put me in this chair talking to you guys tonight, really.
Absolutely. Absolutely. Well, I'm so glad that you followed that path because it put you here with us. And you've always been so supportive of TCAF, and we appreciate you and all that you do. If you're just now joining us, this is Dr. Clint Cary. He's an associate professor of urology at Indiana University School of Medicine. And if you have a question for Dr. Cary, go ahead and pop that in the chat. Dr. Cary, what are things that you wish that your patients would ask you when they come in, especially in testis cancer patients?
Yeah. So, I think it really depends on where they are in the process. I see a lot of patients after they've already got the diagnosis of testis cancer. They're coming here to Indiana University for maybe just further guidance with where to go next. What's the next step? What's the next appropriate step? A lot of them are coming for a retroperitoneal lymph node dissection surgery. And so they're coming to kind of learn and get information about that. So I think it kind of depends on where you are in that process, because there's a little different nuances with each one of those steps. I think, I think a lot of people will hear this that probably come to this meeting or have heard this in their own journey is, this is a relatively rare cancer to get comparatively to other cancers. And so I think that's something that a lot of folks don't realize is just how rare it is. And that's why it's important to, once you get down the treatment path, is to seek, people who are experts and do see this a lot to help kind of guide treatment recommendations, either from a chemotherapy standpoint or a surgery standpoint.
Sure. And by the way, if you end up coming to the virtual testicular cancer conference next week, it will include our packet. I got to think of the word on that. I have it later on here, and I'm going to remind everybody, but basically where you can print it out and document everything that you have. There's great questions in there and prompts for you to talk to your providers so that you know what questions to ask. And then it's like a quick reference guide to know where you're at in your journey. If you end up going to see a different provider, oh yeah, well, I had this and this. So hope that you will come to the conference and take use of that. That's what we're all here for at DCAF. Speaking of RPL&D, Dr. Cary, any chance retro ejaculation caused by RPL&D simultaneously normalizes after a year? That's a question from Facebook.
So obviously that's a known risk factor with the surgery, and it depends on, whether this is a surgery that you have before chemotherapy or surgery that you have after chemotherapy. And those those operations are quite different, and the chances of being able to save those nerves that control ejaculation are different based on that scenario. There are times when you will spare nerves. You have to manipulate them, move them out of the way of all these lymph nodes that you're taking out, and that process of kind of moving them around makes them not so happy, and they have to go through a period of recovery. And so there can be a 6 or 12-month period where you do have either retrograde or kind of what we refer to as anejaculation, just no fluid comes out at the time of an orgasm. And that doesn't mean, within the first 1, 2, 3, 4, 5, 6 months, just because that's occurring, that's going to be permanently how it is. If you had a nerve sparing procedure, it just takes some time for those nerves to recover enough to kind of build that process back up. And it can take a year sometimes. And that answer is different if you just went through a non-nerve sparing surgery because of whatever disease characteristics you had or something like that, where technically the nerves weren't able to be spared. That process is usually a permanent issue. The nerves don't regenerate after you've had to remove them with the lymph nodes. But in a nerve sparing procedure where things don't work, right away, it can take up to a year or so for that process to kind of get back in working order.
Are those done normally robotically?
Well, I think the vast majority are still done open. You can spare nerves open or robotically, but I think the vast majority of the surgeries are still done open. There's obviously interest in robotic surgery, but it's still, from a data perspective and outcomes perspective, we're still trying to see if that is equivalent, in my opinion.
Makes sense. Dr. Cary, how can we be better patients?
Listen to what we say.
Yeah, right.
I think all kidding aside, I think it's just, it's educate yourself as much as you can. This forum is great. You guys do a great job about trying to, put out as much educational material and bring awareness to the disease itself. And so, even if you haven't been diagnosed, just the idea of self-exams and once you are diagnosed, just trying to understand as much about it as you can. Like I said, it's not a common cancer that's diagnosed, so a lot of medical oncologists, they don't see it that frequently, just because there's not as many patients coming through their doors that has this cancer. And so you can educate yourself a lot and help yourself just by kind of digging into learning as much as you can.
That makes sense, of course. Would you say the same thing to caregivers? And do you have any specific things for a caregiver, maybe who's helping a loved one going through this? How can they be better caregivers? Yeah,
absolutely. I think one of the things that I've heard from this group over the years, and even from my own patients talking to them, is because it's fortunate that most men do survive. I think that some of that emotional aspect of you have cancer gets kind of I don't want to say brushed away, but you say, oh, you have this, but you're most likely to survive, so you'll be fine.
Yep.
And so I think just understanding that and not trying to do that, because that is true. You're very likely to survive, but that doesn't mean the path to survivorship is easy and carefree. There's still a lot of things to deal with, emotionally, psychologically, and physically. And so, just trying to understand that. And even though, the outcomes are most likely going to be good, still trying to be there and be in the moment for your son, boyfriend, whatever the relationship may be, to try to be there, every step of the way you can be.
Makes sense. I mentioned this yesterday with your colleague, and I feel that we don't talk a lot about this, but what do you say to survivors? What's your approach for someone who's, either almost at, in my case, or someone who's beyond 5 years and kind of, I guess I get anxiety in the fact that, hey, I'm 5 years out and I'm considered cancer free, whatever. And then, I mean, my oncologist even discharged me from the clinic. My radiation oncologist is a little bit more conservative. So, and I appreciate that. But I get a little nervous that, like, now I don't have that active surveillance, from a provider standpoint. Do you have any, advice for folks who are 5+ years out? What should their mindset be, and what sort of things would they be looking for?
Yeah, well, I would say the first thing is, congratulations. I would say, that's a big milestone and something that shouldn't be, taken lightly, and you should be proud of that. At the same time, it's kind of a weird transition, I would assume, just because you've had this such intense whatever treatment, intense follow-up, and then boom, it's like, okay, we don't need to see you anymore. Bye-bye. So you've had this very good relationship, hopefully good relationship, and then you can kind of feel like you're getting, faded off into the distance. So, I would say, number one, it's a great accomplishment to get to that point. And number two, from just, trying to kind of calm the anxiety of losing that relationship or not needing to be seen at all or as frequently, try to, think about, what could be some symptoms that I may have if I were to have some kind of late relapse. That would most often be something like back pain, or, if you had some new pain in the other testicle or something like that, don't brush those things under the rug. But at the same time, you have to keep in mind that is very unlikely to happen. Right. That's why the doctors are discharging you from their office. You gotta think, most doctors are very conservative. They don't want these bad things to happen to their patients. They want to see them. And so if they're taking that step to say, listen, you don't need to get these CT scans anymore, you don't need this blood work, then that is a sign of confidence that the chance of something, the other shoe dropping, so to speak, is going to be very, very low. So you just try to balance those things in your head of the very unlikelihood of something happening with, if you do feel something that, not something that, had this pain for 20 minutes, what's happening? Right. But if you've had this consistent, back pain or testicular pain that doesn't go away with some, period of time, then call your doctor back up.
Yeah, be on the lookout. Obviously, hopefully have a good relationship with your primary as well. And I'm blessed that I do too, so that I can report anything and, kind of keep an eye on it myself. You got to be your own best advocate in that regard and, look out for yourself. That's true.
That's right.
If you're just now joining us, welcome. It's Testicular Cancer Awareness Month, and we're here with the Ask the Doctor segment. If you're watching on Facebook Live, feel free to pop a question in the chat. We're hanging out with Dr. Clint Cary. He's an associate professor of urology at the Indiana University School of Medicine. Some shout outs real quick from Facebook. Denise says hi from Seattle, and Haley, hello from Monticello, Illinois. Tomorrow, Stephen Crocker, by the way, the host of It Takes Ball, says on the podcast, we'll hear from Olympics figure skater Scott Hamilton, a 25-year survivor. What kinds of lives are we seeing from people after testicular cancer? That's great. I think it's important also that we focus on, thriving, not just getting through this, but, going beyond, the initial treatment and surgery, and then getting through, your remission time and all that. Pretty crazy. Okay, here we go, Dr. Cary, from Denise. Is it true that the risks of teratoma showing up post-chemo dramatically reduce after 3 years?
I would assume that they're talking about, they got chemo, they had disease that had spread somewhere, they got chemotherapy, and you can kind of go several ways with this, but not to try to get too much into the weeds, but kind of depends on what happens to the CT scan. If the CT scan is normal versus you still have some residual. I would assume if you had something residual there, you're probably getting some sort of additional treatment. That's the usual course, especially in the abdomen. If you had, disease that was left over that was larger than a centimeter, most centers are going to recommend surgery at that point. And that is one of the reasons, because there's concern there could be teratoma there, amongst a couple other things. But assume the CT scan normalizes. I mean, there's a low likelihood of having a recurrence if you have a normalized CT scan afterwards. You obviously need to be followed, because that it can be 10 or 12%, at least on data from here at Indiana, of having a relapse that then needs to be treated. But I don't know if I've ever seen it, at least a strong amount of data saying, if you make it past 3 years and that equates with teratoma. I mean, usually once you get the kind of hurdle for testis cancer is really 2 years. That's the biggest risk, is those first 2 years. And if you make it past that, after, let's say you normalize CT scans and you make it past that initial 2-year period, then that risk of having a relapse goes exceedingly low, into the very, very low single digits. And that would kind of what we were talking about earlier, BJ, you get 5 years out, you get what's called a late relapse. That is technically after 2 years. If you've been cured for 2 years and you have a recurrence, that's in our medical world, we term that a late relapse. Mm-hmm. Yeah. And so it's kind of that 2-year mark where your risks are going to drop down exceedingly.
That's interesting. A question that I asked yesterday also to your colleague: anything new on the horizon that maybe you've been reading up on? And I know we're going to talk a little bit about this at the upcoming conference as well, different trials and whatnot, but anything that maybe you're excited to hear as it advances? I always like to see kind of what's happening in the world of TC.
Yeah. We've been talking for a little bit more on the research side, a couple of years ago, but we're still trying to see if this blood-based biomarker, marker RNA 371, is going to be as impactful as we hope it would be. There are some trials that are currently using this to try to explore this in the academic setting, and this is a blood marker that's more helpful, or hopefully more helpful, than alpha fetoprotein and beta HCG, the tumor markers that most people in this audience will have heard of before. And so, I think that is something that's we're really hopeful that some of these trials can kind of lock down how useful this is going to be. I know we're trying to work out with some of the assays, some of the guys around the country that are running this lab are trying to lock down some of these methods to make sure the accuracy is where it should be. So I think that would probably be the next biggest thing that would be helpful in certain aspects of testis cancer for sure.
Awesome. Excited to see how that moves forward. Dr. Cary, when you deal with this, and I know this is probably a very common question for providers of all specialties, but when you deal with stuff, you personally, especially dealing with folks with cancer specifically, how does Dr. Cary find resiliency? What do you do, Doc?
You mean outside of work? Is that what you're saying?
Yeah, sure.
I probably a lot of what you guys may do. You try to stay active and exercise and do things to try to help your body be healthy. And so I try to stay active. I try to work out 3 or 4 times a week. I try to make it to my kids' extracurricular activities. My son's on a travel baseball team. My 2 daughters do competitive cheer. I haven't bought the dad sequin shirt yet, but that's probably in the future. For me, I try to play some golf when I can. That's kind of one of my extracurricular sports that I try to do. So try to be balanced as best I can. Sometimes it's hard, but I try.
Makes sense. I didn't hear you say at any point you like to eat donuts a bunch, so I'm a little worried that I might not be on the right track. I don't know, but they are delicious. They sure are.
They are. They taste good when you're eating them, and then like 10 minutes later, you're like, oh,
you feel bad. Yeah. That's always going to happen. We're hanging out with Dr. Clint Cary, Associate Professor of Urology, Indiana School of Medicine. If you have questions for Dr. Cary before we say goodbye here on the Ask the Doctor segment, promoting the upcoming virtual testicular cancer conference here next week, pop it in the chat. This is your last chance to get something in. Dr. Cary, is there anything that you want to say to anybody out there, how about this specifically? Would you like to say anything to any researchers out there, and maybe some of your colleagues who have never attended our conference and why they should come? Maybe it's a new urologist, someone who just got past their board certifications.
I think if you, I think we're obviously wanting to grow this and grow awareness. I think, I think it's educational. I mean, not every urologist is going to see patients with testicular cancer. It gets back to this kind of rarity of the disease. And so there's some urologists in private practice that that may go 3 years before they see their next testicular cancer patient at all. And so, I think it's clearly beneficial to hear from the patient side of things. I know I say this probably every year, every time we do this. I learn something from your guys' stories every time I come to this. And so I always say I learn as much talking to all the survivors about their experiences, whether it be, side effects they experience that may not get brought up in the office and is more freely to talk about it here. And so, I just feel like this is a very educational thing. And even though, from a medical standpoint, it's not this big national medical meeting that you kind of get ingrained to go to every year. I think there's a lot of educational value here that you would not get otherwise at one of our more, heavy medical focused programs.
Sure, that makes sense. And I would say that that's the same, not just for providers, but for patients and caregivers as well. So come to the conference. Okay, Dr. Cary, Denise has a follow-up for you. Why is 1 centimeter the cutoff for lymph node considered residual cancer after chemo when deciding about RP-LND?
Yeah, that's a good question. It's a little bit of an arbitrary cutoff. I think, certainly the larger the residual disease, there is a higher risk of teratoma. We've actually showed that in some work we published about the larger the size of the residual nodes, the higher the likelihood of teratoma. That being said, that, if we see someone who has a 1.1 or 1.2 centimeter lymph node, depending on what it looks like, sometimes we observe those patients. So there is a little bit of flexibility and nuance there that kind of gets back to that experience and expertise in this field that you need to try to lean on when you can, and talk to people who see testis cancer frequently. And so it's a bit of an arbitrary cutoff, but part of it is because as things at certain levels, the risk of teratoma gets greater the higher it is. So, why don't we watch it at 3 centimeters? Well, we know that something at 3 centimeters is going to have a higher risk of teratoma than something at 9 millimeters. So there's a little bit of science, a little bit of arbitrary as far as what the exact cutoff is.
Awesome. Thank you, Denise, for the question. Well, Dr. Cary, I think that's pretty much it on the questions here. I don't see anything else popping in here on Facebook. If you have a question that you didn't get the opportunity to ask Dr. Cary, you can still put it in the chat. And we might even bring it over to the conference. Who knows? If you got a really good question, we can bring those over to the conference. Anything that you need to mention to the folks out there, Dr. Cary? Is there anything exciting happening at Indiana University that you want to shout out? Or
yeah, I think, first I would say, I just want to, put another plug in for the program coming up next week. It's excellent. I've been in touch with you guys and been coming back when we used to do this more frequently in person. It's 5 years or more now. So, I'm still coming to this. I still learn things. It's exciting. You get to meet new people, each time and hear some new stories. And so it's great. As far as, Indiana goes, I would just say that, I don't have anything large. I will say that I think you guys know about this, but just the first patient that was treated with this platinum regimen by Dr. Einhorn here at Indiana, and really kind of started this revolution of changing the cure rate for testis cancer. Unfortunately passed away recently, and Dr. Einhorn continues to be, a thought leader in how to really drive home that legacy for testis cancer survivors. And he did create this fellowship fund that he's directing to try to continue to educate oncology fellows that train here at Indiana. So I just want to recognize that and pay its respect.
Absolutely. And are you aware? And for the folks that are watching, if you're thinking about coming to the conference, but you're thinking, man, that $9.99 that TCAF is asking to come to the conference, let me be clear, that money that we're asking for the whole household, by the way, to be able to attend, that's anyone that's in your household, so that you can get access to come to the virtual conference. Those funds, we're donating those to the John Cleland Fellowship. So that's our way of carrying on this legacy and what John and Dr. Einhorn and IU have done for testis cancer. So yeah, thanks for bringing that up, Dr. Cary. Appreciate that.
Yeah, absolutely. That's incredible.
Yeah, absolutely. Paying it forward. Well, Dr. Cary, thank you so much for joining us. We appreciate it. And we will see you at the conference.
All right. Thanks. I'm looking forward to it. Have a good one.
You too. All right. That was Dr. Clint Cary, Associate Professor of Urology, Indiana University School of Medicine. He'll be speaking at the upcoming virtual testicular cancer conference. That's going to be next week. And let me show you again. I'm going to share screen here with you so that you all can see what we're talking about. You can go to testiscancer.org if you're interested in signing up and registering. Again, we're asking for $9.99 for your whole family, anyone in your household to be able to come to the virtual conference. We are not taking any of that money from TCAF. We're donating that back to the John Cleland Fellowship at IU. And you could see all the different folks that we have, some of which, some of these providers here and these speakers that we have already spoken to me this month here for Testicular Cancer Awareness Month on the Ask the Doctor segment. So pretty awesome stuff that's going to be happening. Check out testiscancer.org if you would like to know exactly who's going to be there, what topics we're going to be covering, and how you can get further involved with Testicular Cancer Awareness Foundation. I believe that is it. I didn't see any more questions in the chat, so I think I'm gonna wrap us up. On behalf of all of us here from TCAF, thank you so much for watching, and we will see you at the conference. So long, everybody.